Dr. Matsidoso Moeti from Botswana, the first woman WHO Regional Director for Africa, visited Ethiopia for the first time since taking up her post as Regional Director on the last week of March 2015.
I'd like to thank you for the innovations that I've seen on course here in Ethiopia and for your preparedness to join in that spirit and work with the WR and the executive management team. And I ask you now to join in what we are going to be trying to do throughout the region, because I think it will be to the benefit of all of us as individual staff members, and also it will be to the benefit of health in our region, which is ultimately our aim.
The WHO staff organized a Bunna Tatu program, an Ethiopian tradition of having a get-together with a coffee ceremony for Dr. Moeti. Dr. Moeti met with the First Lady of Ethiopia, Her Excellency Mrs. Roman Tesfaye, to congratulate the First Lady's advocacy work in the health sector, namely on HIV/AIDS, cancer and nutrition, and to ensure continued support from the WHO. In a meeting with His Excellency Dr. Kasata Brahan Admasu, Minister of Health of Ethiopia, Dr. Moeti congratulated Ethiopia for its achievements in the Millennium Development Goals and for the success in the strengthening of health systems. His Excellency Dr. Kasata Brahan in turn acknowledged WHO's continued support to Ethiopia in the health sector. Dr. Moeti and Dr. Carlos Lopez, under UN Secretary General and Executive Secretary of the UNECA, agreed to work together in partnership to improve financing for health, strengthening countries' capacity in data and knowledge management, documenting attainment of health-related Millennium Development Goals.
Adequate investment in health, of smart investment in health, which emphasizes insurance, equity, and prepayment, and say that, in our view, this will contribute significantly to improving women's health, to relieving women of the direct expenditures that they make for their families to achieve healthcare, and will help us to move towards Agenda 2063.
The Medlas Zenawi Foundation awarded one Best Performing Warada from each of the 9 regional states and 2 city administrations of Ethiopia for their efforts to reduce maternal mortality. Dr. Moeti attended the ceremony along with His Excellency Dr. Mulatu Teshome, the President of the Federal Republic of Ethiopia, His Excellency Dr. Kasata Brahan Admasu, Minister of Health of Ethiopia, and Her Excellency Mrs. Azeb Masfin, former First Lady of Ethiopia, and other dignitaries.
I would like to say that his visionary leadership was translated into concrete action with his team, and we very much admire, at least in health and also in development in general, the transformation that is happening in Ethiopia today. The RCM today, with this very inspiring theme around the empowerment and development of women. We want African girls to transition from being children to adolescents to women who are empowered, who are healthy, who are educated, and who are contributing to the development of the continent. And we as WHO will do our part as far as health is concerned. Thank you very much.
The World Health Organization and the United Nations Office for Project Services signed a Memorandum of Understanding on the 29th of March 2015 to intensify collaboration on sustainable management of health programs and projects in Africa. The agreement is the first of its kind between WHO and UNOPS in the African region. Dr. Moeti chaired high-level panel discussion on the impact of Ebola on the African continent. The meeting was organized with the aim of sharing information and catalyzing support for the recovery of countries affected by the Ebola virus disease outbreak. Present in the discussion were the Minister of State for the Economy and Finance of Guinea, the Deputy Minister of Finance and Development Planning of Liberia, and the Ambassador of Sierra Leone in Ethiopia, as well as senior experts from the UNECA, AUC, UNDP, and the World Bank Group. Dr. Moeti met with Dr. Mustafa Kaloko, African Union Commissioner for Social Affairs, and his team to discuss the further strengthening of the long-standing partnership between WHO and the African Union. Dr. Moeti and Dr. Kaloko agreed to work together in ensuring the implementation of the international health regulations by member states and the strengthening of country-level capacity to respond to health events and epidemics. A dinner meeting titled Ending AIDS by 2030, the 1990 target as a platform for sound investments, social entrepreneurship, and economic development was conducted by UNAIDS in the Sheraton Hotel, Addis Ababa.
We are committed to working with partners. We are adopting the different approaches to work towards this new ambition, and we will work with other partners to fight for universal health coverage, financing for health, continued attention to communicable diseases, including HIV, to be taken forward in the post-2015 development agenda. I thank you for your attention.
The meeting wrapped up a successful week for WHO Regional Director for Africa, Dr. Moeti, and the WHO Country Office.